The following is a community affairs presentation from the Ulster County Health Department. This is the Healthy Ulster Radio Show, a weekly presentation exploring community health and sustainability with guests representing a broad spectrum of community partners working to make Ulster County the healthiest in New York State. This program is sponsored by the Health Alliance of the Hudson Valley in Kingston, a member of the WMC Health Network.
Good morning. You are listening to Healthy Ulster Radio. I am your host, Dr. Carol Smith, Commissioner of Health and Mental Health for Ulster County. Joining me today is my co-host, Vin Martello, Director of Community Health Relations. Good morning, Vin.
Good morning, Dr. Smith. How are you today?
I'm good, thanks.
Dr. Smith, today's topic is one that is really critical to community wellness and health, and a very, very, very important topic, one that we've been deeply involved in, and that is suicide prevention. And we have today a very special guest who I'll introduce in a moment. But before we do that, can you give us a brief overview of what suicide statistics look like nationally on the state and local level?
Sure. Well, suicide is the 10th leading cause of death in the United States. And in 2013-2014, there were over 40,000 deaths from suicide in the United States. In addition to the tragedy of those who have completed suicide, it is estimated that for every one suicide, there were over 230 who seriously considered suicide. And of the suicides that were did not lead to death, there were over 400,000 emergency department visits due to self-inflicted injury. And about 9 million people actually seriously considered suicide back in 2013. So it certainly is a significant public health problem. And there is a great deal of emphasis by the CDC, the local and state partners on trying to influence these numbers to prevent suicide from happening.
Well, as you know, Dr. Smith, we have a very active suicide prevention coalition known as SPEAK, which stands for Suicide Prevention, Education, Awareness, and Knowledge. It's a multi-partner, multi-sector coalition. And just a few of the things that SPEAK has done over the past several years and continues to do is provide awareness training to school districts. We maintain a website. We created a mobile app for prevention, which people have with them on their mobile devices. It's a free download. We've developed a risk screening assessment tool in conjunction with providers, mental health providers. We work with veterans groups and sportsmen's clubs on awareness and reduction of access to lethal means, and we'll be discussing that more. And we trained and implemented a special suicide response coordinating committee to help communities cope and prevent suicide in the aftermath of a death by suicide event. And we provide in-depth evidence-based training to community partners throughout Ulster County. And on that note, our guest today is Ellen Pendegar. Ellen is an active member of SPEAK, one of our primary trainers for our evidence-based training programs. Ellen is CEO of Mental Health Association in Ulster County, which provides services in 5 counties. Their mission is to strive for optimal mental health for everyone and for improvements in the mental health system. Ellen, as I said, has been involved in SPEAK from the beginning, and she's a certified Assist, Safe Talk, Suicide Talk, and Connect trainer. Good morning, Ellen. Welcome to Healthy Ulster Radio.
Good morning, Ben. It's
Good morning.
Wonderful to be with you. It's wonderful to be with you, Dr. Smith.
Ellen, before we begin, I want to take a moment just to remind our listeners that the information and the content on this program is for informational purposes only. Mm-hmm. If you or someone you love are experiencing signs and symptoms of suicide, please seek professional medical guidance and get the expert help that you need. So, Ellen, from your deep experience, what are the important messages that you would like everyone to know about suicide?
I think first and foremost, I want to tell them that there's hope and help available, that most people who have thoughts of suicide often feel alone, and also their loved ones and people that care about them feel that they're alone and that there's no one out there that is concerned about them. In fact, there's many of us out there. So if there's any message I want to get across stronger than any of them is that there are people in the community that care about people's lives, that want to help people stay alive. And some of the statistics that I know, and I've done the training, is that at any one time, 1 out of 20 people in any community is thinking about suicide. So if you look at the statistics of our population, that's about 9,000 people right now in Ulster County are thinking about suicide.
Wow.
And what I want to let them know is that there's help there and there's hope for them. I just also want to acknowledge that thinking about suicide has been around since human beings have been around. It's something that can happen to anyone depending on what's going on in their lives, and that our main emphasis is to help those people who have thoughts of suicide not have that lead to actions, because once your thoughts go into actions, there's injury and death. So the main message is we want to be there to help you when you're thinking about suicide.
Mm-hmm. And what are I know there's a lot of misinformation and myths surrounding suicide. What are some of those? One primary one is that suicide is not preventable. People think that often persons with thoughts of suicide go immediately to action, when in fact, when people are thinking about suicide, there's often a great deal of time that they're thinking about suicide and not acting on them. So that's the time that we want to be available to them to help them not have their thoughts go to action. So we want to let people know that it is preventable, that some people hear about warning signs, and there are warning signs, but I also like to think about them as invitations, that people are sending us out signs that they're thinking about suicide. And the more that we can become alert to those signs, the more quickly that we can help the person with thoughts of suicide. So we believe that it's preventable. Obviously, we would probably not be able to keep everyone alive, but the national emphasis is now on zero suicide. So all of us really would like to save everyone. And the best way to do that is to be available, to be alert, to be able to pick up the signs that someone is thinking about suicide, and to consider those signs as invitations to help. Mm-hmm. That's the most important thing. I think another myth, I can give you several of them, is that people who are talking about suicide are not serious about it. People think if you're talking about it, you're not serious. I just want to let people know that people that are talking about suicide should be taken seriously. Anytime someone's talking about suicide, it should be taken seriously. And there are some people who think about suicide on a daily, hourly basis, and people are each day struggling with that issue of living and dying, and those people are living, so they are doing their job and keeping themselves alive, and we want to make sure that we're there to help them to keep themselves alive. Another important myth to dispel is that people think if you're picking up these signs and you ask them if they're thinking about suicide and they're not, that you could plant that idea in their head. That's not going to happen. Human beings are not gullible to have somebody put a thought into their heads if it's not there. And the message we'd like to tell them is that people who are thinking about suicide would love to know there are people that are willing and feel confident and courageous to ask that question. Because it's a cry for help.
Yes, people want help. Mm-hmm. People want to be able to say yes to somebody. We do not talk about thoughts of suicide directly and openly in our culture right now. But openly and directly talking about suicide is a key to preventing suicide. So we want to help people to be able to ask that question and not think that you could put that idea in someone's head.
And it's really critical, isn't it, to try to, so to speak, buy as much time as possible between the time that someone thinks about a suicide and they actually act on it, that if you can put some space in there to get past that, maybe that impulsive point, mm-hmm. Where people, think more about why it's worth living and the difference that they're making in the lives of their loved ones.
And I think it's important to realize that not everybody who thinks about suicide acts on it. Mm-hmm. There are a lot of people out there that really have the resilience, even despite having thoughts of suicide, to keep themselves alive. Mm-hmm. And so, yes, the idea that suicide goes from a thought to an action, that it's an impulsive thing, those are the suicides that are very, very rare. And so we do think that most people have time between the thoughts and action, and they are sending us out signals about that. And when I talk about signals, we're talking about especially if you know someone very well, if you start seeing changes in how they act changes in how they talk? Are they feeling alone? Are they feeling like there's no way out? Are they feeling no one cares about them? Can you see, can you learn things about someone? Are they going through losses? Or are they going through things that are feel like there's something they cannot escape from, and that it would be better, they'd be better off dead? So you can see things that people are doing. You can hear the way they talk. You can also sense. You can sense when someone's feeling desperate. You know, people think that if you're depressed, that could lead to suicide. And that does happen, but not every person who's depressed thinks about suicide, and not everybody who thinks about suicide is depressed. People who feel desperate, people who feel like there's no escape, they can be at risk of having thoughts of suicide. And the more that you know about their situation, those could be signals or invitations to ask if what's going on in their life has anything to do with suicide.
Well, if you're the untrained lay person, though, how do you distinguish the everyday blues from someone who's really, perhaps going, falling deeper into that
I think
direction?
the best way to do it is taking advantage of some of the trainings that we have available to people in our community. There's a 3-hour training which is called Safe Talk. And what you learn in that training is to be able to identify people who have thoughts of suicide, and then how to hook them up into services where they can get help. So there is a skill to it that can be taught. But the thing is, especially for people that you know well, if you sense that things are changing, you're seeing things different, them doing things differently, you're hearing things, even if it doesn't appear like a negative thing. Some people start putting things in order. Somebody who might be terribly not good with their finances, and families could be worried about them dealing with their finances, and then all of a sudden they're putting their finances together. Most families would then start, well, that's a good thing. But that could also be a major change for somebody, and that could signal that they're trying to put their affairs in order before they die. So it's the more that we're open to seeing changes in the people that we care about, and even in ourselves, those changes, because even in ourselves we might not recognize that we're now going into a situation where we're going to have thoughts of suicide. So I think the best thing to do is to realize that you can learn to be suicide alert, and that's what Safe Talk does.
And I've always been curious. I mean, there's also a perceived stigma that goes along with suicide, right?
Absolutely.
So you might say, like either for yourself or a loved one, gee, if I say something about that, it's going to trigger a whole series of events that's going to make that person's life more difficult and maybe cause them embarrassment, or feeling that somehow they're falling out of their community status or whatever by admitting that a weakness, or not even a weakness, but a vulnerability.
Yvonne, you're absolutely true. The reverse side of that is, though, if you don't intervene, what could be at risk is their lives. So the consequences of not asking them are more serious than asking them. And the other thing is that another myth is that only people who are acting strangely are thinking about suicide. It is something that could happen to any of us, depending on what's going on in our life situation. So when we see changes going on in a person, that's the time that we might want to connect with them about whether that has anything to do with suicide or thinking about dying.
We want to hear more about this really fascinating subject, but we're going to take a short break right now, and we'll be back soon. You're listening to Healthy Ulster Radio, and we're talking about suicide prevention. Be back soon.
The excitement continues to build. The mission of Health Alliance is now made even stronger by our new partnership with the Westchester Medical Center Health Network. By combining a legacy of community-based care with WMC Health, we are building a stronger, healthier, and more vibrant community. We'll be collaborating to provide preventive, primary, specialty, and advanced care right here where you live, where we all live. Health Alliance and WMC Health, advancing care here. Visit HAHV.org to learn more.
Welcome back. You are listening to Healthy Ulster Radio. I am your host, Dr. Carol Smith, Commissioner of Health and Mental Health for Ulster County. With us today is our special guest, Ellen Pendagar. Ellen is CEO of the Mental Health Association in Ulster County.
Ellen, before the break, we were talking about that anyone can be vulnerable to suicide, but we do know that there are some higher risk groups, just statistically speaking, and we kind of covered those when we created the mobile app, the
Right.
Speak mobile app,
Yes,
to
we
really
did, yeah.
focus in on those areas. What are those groups, and what are the unique circumstances that surround their lives and experiences?
Well, I think in our Speak app, we talk about young people and the situations that can rise up in young people, because they don't always have all the resources that we have available to us as we've grown and experienced life, so that they can face challenges and not have the resources, and then therefore thoughts of suicide can come up. So we do concentrate on young people. It's the third leading cause of death amongst young people is suicide. We also talk about veterans and some of the situations that they've faced coming back from situations in the military. So our Speak Act does concentrate on that too.
And I think the vet that we were featured in the video on the Speak app talked about, after 14 consecutive years of some form of conflict and multiple deployments. So, there are relationship issues that develop, financial stresses, substance abuse stresses, combat-related stress, all combined together and then reintegrating into society. We know that it's a very, very serious challenge for the veterans community, and that the Veterans Administration and others are focusing a lot more attention on that.
And certainly those group of people who've done the honorable thing to serve our country, to keep our liberties protected for all of us. Certainly, that we would want to reach out with hope and help for them, that we could be of some assistance with any of those transitional issues that they're having coming back from any military experience. Certainly, we would want to make sure that we do that.
And the third group are older adults.
Yes.
Tell us about that group.
Yeah, and I don't want to miss a fourth group, because some of what we're seeing in Ulster County is that middle-aged males that have been the people that have been dying by suicide here too. But I think the older adults is because our culture doesn't always honor the changes and the wisdom that come with aging. I think aging in the United States, where youth is seems to be held up as
right. If
the most
you're not
important
young,
thing.
Rich, and beautiful, you're
Right.
somehow less
Exactly.
person.
Right. So I think it's a little harder to make those transitions. And obviously, as you're older, you are dealing with more losses than you are in other times of your life. So if you put that together with a sense of you not having as much value in a community,
and health issues too,
health issues,
financial issues.
As I'm aging, I say I'm aging in place. I use that term, but I'm aging in place of my body. So we all have to deal with the changes that come along with us being older. So I think we make it more difficult, I think, than needed to age in our culture. So.
And I know that Speak 2 has some active outreach to the sportsmen's community and also to the veterans community. But why in particular the sportsmen's community and, say, gun shop owners? What we talk about access to lethal means. What does that mean, and why is it relevant?
It's probably been one of the most exciting and satisfying initiatives that we've done over the last couple of years.
Well, but before you go on, Ellen,
Yes.
over 50% of suicides are done with the use of firearms. So certainly it's very important to if someone recognizes that there's a family member that may be at risk of suicide, but certainly under all circumstances that guns need to be securely locked and or perhaps removed from the house if someone is actively depressed and has potential to commit suicide. So maybe you can tell us then more about that initiative with respect to working with gun shop owners in helping them to address this issue with their customers.
Yes, and we've done a lot of work with the gun shop owners and the Sportsmen's Association, and the bottom line is that gun safety is an important piece of what the Sportsmen's Associations and gun shop owners and us as Speak and suicide prevention individuals, that we share the same focus is gun safety. I think that what we've when we say means restriction or means reduction, is to keep the time from the thought to the action we want to make sure there's enough time, because sometimes those are short. So we want to help people, if you have the thought and you're thinking about the action, is to have time before you could get to a means. Because if you're thinking about suicide and had a plan to, and you have a gun right there that's loaded, it won't take you much time to get to the gun. But if you have some space between your thought and your plan and actually getting to the means to carry out the plan, there's a better chance that either help will intervene or your thought of wanting to stay alive will intervene. So the longer you have between your thoughts in the plan and how you could carry out the plan, the more chance that you will be able to keep yourself alive. So that's when we talk about, when Dr. Smith said about making sure the guns are securely taken care of, or you may want to make some plans about what you would want to do with your guns if you are thinking about suicide. You may not want them close by. We've learned a lot from the Sportsmen's Association about things that can be done to keep you safe from your firearms. We've had our law enforcement agencies being open to securely taking people's guns if they want to voluntarily have them away from themselves for a while. So we've done a lot of work around having people have the help they need to keep themselves away from a possible means that they would use if they were thinking about suicide.
So it's very much a peer-to-peer response, really,
yes.
Right? It's gun shop owners and sportsmen's associations and customers of gun shops really just looking after their friends and their loved ones to say, we want to protect our freedom, we want to protect our right to own guns and use them, but we also want to keep our friends and our family members safe when someone is struggling or in crisis. And I think that's really, really a critical
right. Gun
issue.
Safety is definitely a shared value.
Yeah. So tell us a little bit about your trainings and support groups. First of all, in your trainings, what are some of the topics that you covered to help people, maybe people who are on school staffs or people in the community, to understand what really is important to know about suicide and what they can do as individuals and organizations to prevent it?
I mentioned that the Safe Talk training, which the reason I kind of emphasize that training is that because it's 3 hours and it can be taught to just anyone, and sometimes it's easier to have people be able to focus for 3 hours because some of our trainings are longer. But in Safe Talk, it's divided into two places. The Safe Talk and Talk is teaching people 4 steps. And being suicide alert. So the T is tell. How do you tell that a person is thinking about suicide? And those are those invitations or those signs. And then we do how do you ask somebody once you pick up those signs? That's the A in talk. L is then how do you listen? Once a person says they're thinking about suicide, how do you listen to them about that? And then K is keep safe. Once you know that, how do you help them to stay safe? Okay. And then the second part of that training is those steps are fairly easy to do. But how do we dismiss, and avoid our ability to use those steps? Because there's lots of reasons why there's a lot that interferes with our ability to use those steps. And then we do the practice. We actually go through and practice what it would be like if you were a caregiver to somebody with thoughts of suicide. So that's a 3-hour training. The ASSIST, which is the Applied Suicide Intervention Skills Training, is a 2-day training where anybody in the community can be taught how to do an intervention, can be one of those people that can help to keep someone safe. It's like doing CPR for a physical problem. This is a first aid resource for somebody who has thoughts of suicide. That takes 2 days to do that training. Really terrific. And I know you have Mental Health Association has some support groups, right, for people and families who have experienced. Well, actually, the support group that we have, which is not many people have offered this, and we found it to be very helpful, is that we have an hourly support group that we co-lead with People Incorporated, which is a peer-run mental health organization for people who think about suicide. So they can come to our center, which is in the Martin Aaron Office Complex down by Hannaford's and Herzog's. In Kingston. Right. Every Monday from 6 to 7. Mm-hmm. So we give people an opportunity to openly and directly talk about suicide and why it's in their life right now. So it's been running for almost 3 years now, and we found that it's been very helpful for people. So we wanted to make sure we gave them a place where they could openly and directly talk about it. And they can find out more
more about this by going to your website. What is that
Yes,
web address
the website
and phone number?
is mhainulster.com, or the number you can call is 845-339-9090, and you can ask for information about our Live for Today support group, Live for Today support group.
That's terrific. And we also have a lot of other great resources, as we mentioned earlier. The Speak mobile prevention app, it's a free download in the Apple Store or on Google Play. Just search for Ulster County Speak and you'll find it. You can also go to our Health and Mental Health Department website. Just Google Ulster County Suicide Prevention. You'll get to it. I'm going to give you some critical phone numbers here, too, for our listeners. This is the National Suicide Prevention Hotline, and it includes a special Veterans Hotline within it. It's 1-800-273-8255. That's 1-800-273-8255. There's also the Family of Woodstock Crisis Hotline at 845-338-2370. That's 845-338-2370. And Family of Woodstock also has a text and chat line at 845-679-2485. Again, please consult those resources. Download the Speak app. Go to Ellen's website or the Ulster County Department of Health and Mental Health website. There's a wealth of resources. We want you to know that as a community that we've got your back. We're here to help you. There are incredible people like Ellen, Dr. Smith,
and yourself, Vin.
Coalition.
Vin was very instrumental in getting the Speak app.
And we're here for each other because, life is challenging. It has, wonderful moments and difficult moments, but we're all here to help each other make it through. So, Ellen, thank you so much for being part of this show. It's such an important topic.
Well, it was an honor to be with both of you and to continue our work together.
And Dr. Smith, thank you for your support for
Absolutely.
all those efforts. Our community is really, I think, I was down at the Maya Gold Foundation benefit in New Paltz the other night with Natalie Merchant and friends, and I have to say that it was one of the most uplifting and positive experiences ever. And I've been to a lot of concerts in my day, but this was really tremendous to see an entire community come together.
There's
really
a lot of support
we're
in our
in this
community.
together.
Yeah, absolutely.
It's really terrific. So, on that note, that's really just about all the time we have for today. A great topic, and if you'd like to know more about this topic, if you have any questions or comments, or you want to know about any other topic we cover, please send us an email at healthyulsterradio@gmail.com. In the meantime, please stop in next week for more great information that you can use to keep yourself, your family, and your community healthy and strong with Healthy Ulster Radio. Thanks, and bye.
You've been listening to the Healthy Ulster Radio Show, a community affairs presentation from the Ulster County Health Department, sponsored by Health Alliance of the Hudson Valley in Kingston, a member of the WMC Health Network. Thanks for listening, and be sure to join us for another edition of the Healthy Ulster Radio Show next week.